Hey everyone, Dr. Nick here, family chiropractor. I'm just going to answer a question that a lot of women in particular have, which has to do with when they're pregnant, like Heidi is here at 36 weeks, how can a chiropractor adjust me? Is there any way that they can adjust me, one, safely or even just comfortably? Like, how could they physically do it? So I want to go over how we can maneuver the table around. There's a few different things we can do so that it's definitely safe and comfortable for you to be adjusted and help you through the pregnancy feeling a heck of a lot more comfortable. So one of the first things we're going to do, I'll just have you standing up, Heidi, for a sec. And just moving actually just to this side here. So one of the things we can do is modify the table itself. It can actually raise all the way up. And then that way when they're laying on their tummy, which we'll have Heidi do in a second, their belly is hanging over the edge, which makes it feel like there's no pressure on your tummy at all. So the other thing that we'll do is use these pillows that have got like a hollow center, and we'll actually stack two of them together to put under her belly, and that way that'll make it that much more comfortable. Something we often use too initially, especially in the first trimester or after having had the baby, is oftentimes women's chest is quite uncomfortable and sensitive, and we'll put it across to make it more comfortable through their chest as well. So what we'll do now, we'll stack two of these up, and Heidi, I'll have you on your tummy for you. Cool. Is there any discomfort there at all?
No, it's very comfortable.
Perfect. So from here, what I can do is I can have a look and check how Heidi's back is doing in a comfortable position, and most women love it because they never get to be on their tummies any other time. And there's a few ways we can go about adjusting Heidi's low back. I can either use a drop table where this little piece underneath her pelvis raises up, and then when I press on her pelvis, pushing down, it'll make a loud noise, but the table just drops a little bit. And I'll just do that so you can hear what it would sound like, just like that, as I would press through that lower back. Now that's quite safe because there's no pressure going through the baby, through the belly, which is higher up. It's more just through the joints, through that pelvis, which oftentimes are quite strained throughout that pregnancy. There's another way we can go about doing it, which is I'll have you tilting over onto your side, Heidi. So we just use this pillow on the side just to give her belly a bit of support so that it doesn't fall over to the side and put just a strain. Is from this position here, we can bring Heidi over and adjust any joints through her lower back that need to be worked on as well. So that's the ways we can make things more comfortable and safe for you guys. In some instances, I'll have you sitting up, Heidi. Some women are quite uncomfortable laying down either on the tummy or the side is just too uncomfortable. We'll actually do the whole visit sitting down, and I'll just be behind them working on them that way. So hopefully that answers some of your concerns or questions about how we can, as a chiropractor, work on pregnant women. Thanks, Heidi.